It's a rough road to be sure. An expectant mother does everything by the book. Not so much as one glass of wine or a single puff from a cigarette. Together, she and her husband are a case study in the best possible prenatal care. Then, suddenly, 1, 2, 3, even 4 months before the blessed event, their baby decides to make an early appearance. And quickly, their absolute best intentions are thoroughly overturned.
It was scary. There's no other way you could describe having a baby with wires.
Every year, about 11% of the babies born in the United States are born prematurely. Michelle Drucker is representative of many mothers who have premature babies.
The whole time that I was pregnant, you're thinking of a 6-7 pound baby. To have a child, the first time you see him, he's got a tube down his throat. You've got wires all over them, cords attached to their toes, Basically, Michael was 13 inches long. He was born at 711 grams, which is about 1 pound 9 ounces, at 27 weeks, 2 days.
As it turned out, her son Michael was just the first of 2 premature babies. Her daughter, Alexandra, followed in her brother's footsteps about a year and a half later.
Alexandra was born at 2.5 pounds, 1,160 grams, which, it still seems small, but when you compare it to Michael, it's huge.
While premature infants may need extra care at first, most of them will usually catch up with their peers in height and weight by the time they reach 2 years of age. In fact, 80% of babies born after the 30th week of pregnancy will have no long-term health or developmental problems at all. Still, since premature babies are born before they are physically ready to leave the womb, they may face a wide variety of medical problems. Underdeveloped lungs, an underdeveloped liver, low body weight, and underdeveloped eyes. Some of the more common health issues include jaundice, maintaining the proper body temperature, and respiratory distress syndrome, or RDS. Many times the causes for premature birth are unknown, while other times the causes are all too familiar.
Mothers who smoke deliver premature babies. That's one of the problems with smoking. And indeed, mothers who are in houses where secondary smoke is tend to have somewhat increased risks of premature babies.
Other reasons for premature birth include problems with the mother's cervix, urinary tract infections, and infection of the membrane lining the womb. Additionally, some families have a history of having premature births without any apparent problems at all. Multiple births are another factor.
Multiple births will cause premature birth because there's too many babies in too small a space and they want out, if you will. They're knocking at the door. It's crowded in here.
In Michelle's case, she suffered from a condition called preeclampsia, which meant her blood pressure increased enough to put her baby in danger.
You're thinking to yourself, what could I have done differently? And you're in a way, yeah, you beat yourself up because you're like all of a sudden you're retracting your, the last 27 weeks going, what was wrong? And the more I found out, though, talking to doctors, that in reality, there really wasn't much I could have done to change it at that point.
And as difficult as it may seem at times, the vast majority of premature births have very happy endings.
You read about it, you hear about it. These children, they get bigger, they get better. They play, they walk, just like any other kid. And once you see them out there, you're not going to see that they're any different than any other kid.